Hi everybody, welcome to Medicine Check. This is Dr. Taj. Today we are going to learn about one of the most important concepts for our NEETPG and the next entrance point of view also. So that topic is CHF. Okay, so let's start with the CHF. So guys, everybody should understand first of all what is CHF. Okay, so what is CHF? We'll divide the term first of all, right? So this HF means heart failure, right? This is heart failure, while this C is congestive. Okay, so congestive heart failure. Heart failure means what, right? So first of all you should understand what is meant by failure of the heart. Okay, what is the ejection fraction of heart? What is the normal ejection fraction of the heart? That is, normal ejection fraction of the heart is 60 to 65% equivalent, right? If because of any factors, right, if because of any factors this has been decreased less than 60%, then that is termed as heart failure. Oh, okay, in simple terms we can tell it as failure to pump out the blood. Failure to pump out the blood. Okay, that means heart is unable to pump out the blood at its full capacity. Its capacity has been decreased compared to the normal heart. Okay, normal heart will be having ejection fraction of 60 to 65%, while the heart failure heart will be having less than 60% ejection fraction. So that is termed as heart failure. Okay, and I will explain you about this congestiveness in the coming thing. So first of all we should understand what happens within the what happens in the heart failure. That means we should know the pathophysiology of the heart failure. When you will get to know about the pathophysiology of the heart failure, then only you can correctly treat the patient, right? So first of all we'll begin with the pathophysiology of the heart. So first of all we'll begin with pathophysiology of the heart. Okay. So what happens in the pathophysiology? So I'm writing in a what you call small terms so that you should also understand. And so let's start with the heart failure. Okay, so I'm writing here heart failure, that is congestive type of heart failure, right? So what happens in the congestive type of the heart failure? Ejection fraction is decreased. Ejection fraction is decreased. If the ejection fraction is decreased, that means cardiac output. What happens to the cardiac output? Cardiac output will also be decreased. Okay, cardiac output also decrease. So in order to maintain the normal cardiac output, brain will be activated. Okay, it will tell the sympathetic nerve system. Now the sympathetic nerve system will come into play to maintain the cardiac output within the body. So what happens because of these? Sympathetic, okay, sympathetic nervous system will be activated. Okay, will be activated. How it will be activated? Okay, it will be activated by release of adrenaline and noradrenaline. Adrenaline and noradrenaline, and the released noradrenaline will go and act over the beta receptors. Okay, go and act over the beta receptors which is present over the heart, right? Beta receptors in the heart. So because of this, what happens? Heart rate will be increased. Okay, now the heart rate is increased. Because of this, cardiac output will be increased. Okay, cardiac output will be increased. Yeah, that's fine. Everything will be fine if the cardiac output is increased. But there are other problems when the sympathetic system will be activated, right? So let's see what happens with the sympathetic system, sympathetic nervous system. Okay, the released adrenaline and noradrenaline not only acts over the beta receptors of the heart, but also acts over the beta 1 receptors over the JG cells. Okay, it will act over the beta receptors over the JG cells. Okay, What happens if the JG cells will be activated via the beta 1 receptors? It will release angiotensinogen. Angiotensinogen. Okay, and we all know that the RAS activator system, okay, this angiotensinogen will be converted into the angiotensin 1. Again it is converted into the AT2, that is angiotensin 2. So what happens with this, sir? So what happens? See, this angiotensin 2 will cause the vasoconstriction in the blood vessels. First problem that causes the vasoconstriction of the blood vessels. Okay, again it will act over the adrenal medulla also. Okay, it will act over the adrenal medulla. So what happens if it acts on the adrenal medulla? If it acts over the adrenal medulla, it will again release the adrenaline and noradrenaline. Okay, adrenaline and the noradrenaline. Again, it will also act over adrenal cortex also. Okay, adrenal cortex also. Right. So what happens if adrenal cortex is sorry, I'll take out the next slide also. So now I'll write here, adrenal cortex is also activated. So what happens? It will cause the release of the aldosterone. Okay, it will cause the release of aldosterone. What this aldosterone does? Okay, everybody has to know what this aldosterone has to do, right? So let's see. Aldosterone causes loss of H plus and K plus and the gain of sodium plus water. Okay, they are gaining the sodium and the water, and also this aldosterone also acts. Okay, this aldosterone also acts on cardiomyocytes, right? It acts on the cardiomyocytes. Okay, so this causes continuous stimulation of the cardiac myocyte, which may leads to LVH. What is LVH? LVH means hypertrophy. LVH means hypertrophy of the left ventricle will be happening. Okay, so these are some of the problems which are caused because of the beta 1 receptors activation over the JG cells. Okay, no, don't worry. But the topic is not still it is not complicated, it is complicated. Okay, so let's see. So only sympathetic nervous system basically acts via which receptors? One is the beta 1 receptors and other one is the alpha receptors. Okay, we have seen the beta receptors. So what about the alpha receptors? Okay, now we'll go for the alpha receptors. Okay, if it is activated, what happens? If it is activated, if the sympathetic nervous system is activated, alpha receptors will be activated. Okay, alpha receptors are present over the mainly blood vessels, which causes the vasoconstriction. Okay, and we all know blood vessels are of two types. One is the venous and another one is the arterial blood vessels. So first of all, we'll see the arterial blood vessels. Okay, so blood vessels we'll see arterial blood vessels. Arterial blood vessels. So what happens over the arterial blood vessels? These arterial blood vessels will be vasoconstricted. Okay, these arterial blood vessels will be vasoconstricted. If these arterial blood vessels, what is the actual location of the arterial blood vessels? It is located all over the body. Everybody knows that. In view of the heart, it is located in the total body. Okay, body plus organs, right? Body plus organs. When the pressure within the arterial blood vessels is increased, okay, when the pressure within the arterial blood vessels is increased, the left ventricle has to contract vigorously to overcome the pressure and to pump out the blood from the left ventricle, right? So So the left ventricle contraction must be vigorous. Must be vigorous. Okay. So to pump out the blood. To pump out the blood. So because of this, what happens? There are higher chances of LVH. Again, the hypertrophy will be occurring, right? And this load over the heart is called as afterload. What is meant by afterload? The load over the heart even after, not even after, after pumping out the blood into the blood vessels is called as afterload. Okay. So till now we have seen only the arterial blood vessels. Now we'll go for the venous blood vessels, right? So let's go for the venous blood vessels. So it will act over the venous blood vessels also, right? When the venous blood vessels will be activated, then what happens? Venous return will also be increased to the heart. Venous return increases to heart, right? So because of this, what happens? What type of load increases over the heart? That is preload. Okay. So preload will be increased. So these are the factors, right? These are the factors which causing the heart to suffer. Okay. So what we should do? So what happens over here? I'm going to show you what is going to happen with the heart in these conditions. See, this is the heart, right, with the 4 chambered, and these are the blood vessels which are bringing the venous blood. Okay, venous blood, and these are the blood vessels which are carrying the oxygen, right? So sorry. So these blood vessels will be pulled up over here in lungs, right? And this will bring the oxygenated blood. Okay. These are the organs over here, and this will supply the arterial blood. See, so this is the thing what is going on. Okay, this is the heart. Okay, this is the heart, and now I am going to write the important things. Sorry. So this, the blood which is coming to the heart, okay, the blood which is coming to the heart is called as preload. This is called as preload. Okay, if the blood vessels, if the arterial blood vessels are vasoconstricted, means these blood vessels are vasoconstricted, then it has to exert a lot of pressure to contract, right, after load. Okay, so this one is the preload, this one is the preload, and this one is the afterload. Okay, so what happens? Over the period of time, what happens? Heart has to contract vigorously. Okay, it has to contract vigorously to pump the blood outside the left ventricle. Okay, after some time it will lose its capacity, it cannot pump the blood. So what happens? There will be development of the back pressure. There will be development of the back pressure, and there will be formation of edema. There will be formation of edema within the lungs, which is called as pulmonary edema. What type of pulmonary edema? This is cardiogenic pulmonary edema. This is cardiogenic pulmonary edema. Okay, this is cardiogenic pulmonary edema. Because of this, what happens? Heart is actually sandwiched between the 2 lungs, right? So in the lungs, and now what happened now? Now the lungs are accumulated with the water. right? And this water will cause the congestion over the heart. So in this broad sense, it is called as congestive heart failure. So what is the major thing what we have to do? We have to stop the pathophysiology of the CHF. First one, we have to reduce the preload. How we should reduce the preload? We should reduce the preload by taking out the fluid. How can we take out the fluid? In the form of urination. So that is called as diuresis. Okay, we should decrease the fluid. Next, we should decrease the afterload of the heart. That means the blood vessels which are vasoconstricted, okay, those blood vessels must be vasodilated, right? Next, we have to decrease the heart rate. Why? To decrease the normal load of the heart. Okay, because heart is actually it is in a failure state. It is unable to work, and you are telling, and the heart is working like anything. Okay, so again the failure condition will be worsening. So these are the three conditions which we have to treat in a CHF patient. Okay, so now we'll go for the CHF treatment. So now how to do the management? First is to decrease the fluid. How can we decrease the fluid? With the help of loop diuretics. We can decrease in the form of loop diuretics. Okay, and now second one, I have to decrease the, what I have to decrease? I have to decrease afterload also, right? I will decrease afterload now. Okay, afterload. How I should decrease the afterload? By giving the vasodilators. By giving the vasodilators. So we all should know the examples of the vasodilators also, right? So some of the examples. Venodilator, well-known venodilator, everybody should know. What is that? That is NEETPG or nitrates. We can tell simply, we can give a term called as nitrates. There are a group of drugs which are included within the nitrates. Okay, or simply we can give arteriodilators also. Arteriodilators. Okay, arteriodilators. An example of arteriodilators is hydralazine. Right, hydralazine. Or we can give arterio plus venodilator. Okay, we can also give arterio plus venodilator. Arterio plus venodilator, and the drugs included in the arterio venodilator are sodium nitroprusside, ACE inhibitors, ARB blockers. So these are the things which are included under the arterio plus venodilators. And now we should decrease the load of the heart, or we should decrease the workingness of the heart. Okay, we should decrease the workload of the heart workload. How? By decreasing the heart rate. Okay, that means we should decrease the heart rate. How can we decrease the heart rate? We can decrease the heart rate by the help of blocking the beta 1 receptors. So we must give the beta blockers to the patient. Okay, we should give beta blockers to the patient. So what is the safest beta blocker that is given in the cardiac patients? That is so drug of choice will also be that thing, that is metoprolol, because metoprolol has proven the mortality benefit in the cardiac patients. Okay, so these are the things which are included with the CHF, and now actually till now we have discussed about the pathophysiology of the congestive heart failure and the management of the heart failure. When you will understand the pathophysiology of the heart failure, then only you can treat the patient accordingly, right? So I hope everybody has got some useful information with this video, and hope you guys, all the guys, like this video, and please share with your fellow beings. And signing off, this is Medicine Jerk.